all Bonami's family. Great supportive community, close-knit caring family. We're non-judgy, blanket fuzzy, stigma-free. All Bonami's family, friends, family, and community. We all Bonami's family. Teacher sharing is our key. Great big thanks to you all.
Hello, and welcome back to another episode of Stigma Stompers, Nami County PA's one and only podcast. I'm one of your hosts, Abby.
And I'm your other host, Janana.
Today we have with us two very special guests, Leanne Hapt and Pati Patlos. We're going to be talking about SAP and teen substance misuse, and I'll just let you guys kick it off by introducing yourselves. So if you can share a little bit about your roles and what kind of your day-to-day looks like when it comes to youth mental health and substance misuse.
Sure. I am Leanne. I am the executive director from Pyramid Healthcare. I am at the Erie office, and I have been with Pyramid for about 12 years. Started off as a counselor, kind of made my way through some leadership roles, and really for day-to-day, I am in charge of operations. So that's everything from taking care of staff and training to the client experience to just ensuring that our office is providing quality of care.
And I'm Pati Patlos. I work for Erie Public Schools. I'm formerly based out of Collegiate Academy, and I'm a mental health specialist as well as clinical team leader. So I help with the overall supervision of the mental health specialist, just kind of the day-to-day type questions. And in my official role as mental health specialist, I work individually with students at Collegiate Academy. I perform assessments. I make referrals out. I work one-on-one with students and consult with parents, teachers, really just everything that kind of falls within a regular student day.
Perfect.
Awesome.
Great. Well, thank you for the really great work that the both of you do.
Yeah.
That's very needed.
Yeah, absolutely. Starting at a younger age, I know we've talked about it multiple times, is so essential. So what inspired both of you to do the jobs that you do?
I think it's pretty simple for me, and I'm sure Pati would agree. It's just simply helping someone. There is a lot of folks who don't have a support or someone to give them even a listening ear. For a lot of folks, our office and my team, we are that safe place. We are that voice of listening and really the person that will help them. I think sometimes it's even just helping someone with the smallest thing is really rewarding and why we keep doing what we're doing.
I totally agree. I got into this field because I really enjoyed helping people, and especially working with teenagers. They are a lot of fun, and they do keep you young, and it's just amazing, especially in a school setting where you have so much access to students, and you really just see that progress, and you see them, doing better, and it's very, very rewarding.
I feel like in any job, just seeing the impact that you're making and the difference, it's just, I know even for us going to programs and the changes that you see and how much you're helping people, it just makes that much of a difference, even on the tough days, I'm sure.
Mm-hmm.
Kind of getting into the meat of our talk today, what are some of the most common mental health challenges that you're seeing in teens and adolescents, and how does that connect to substance misuse disorders?
I would say that we see a lot of anxiety and depression, and specifically where I'm working on the DNA side of things, a lot of students or even adults will say that they're using because they do feel anxious or depressed, or it's a sense of a coping skill, would you say? Obviously not the healthiest coping skill, but I think that's what we see the most.
Yeah, I agree. Anxiety, depression, the behavioral disorders, which will then manifest itself into like the drug and alcohol abuse. And again, we also have to think of children developmentally. I'm sure that at the elementary level, they might be seeing some different things versus middle. So I'm high school, so that's the majority of what I see.
Gotcha.
Yeah. So are there any certain trends or substances that you're seeing more frequently in the work for young people?
Absolutely. I would say over the past couple years, vaping is the hugest trend. A lot we've seen in the past year or two, the THC and the marijuana in the vapes. We see a lot of, unfortunately, students bringing them to school and using them. And I would still say at the end of the day, we see a lot of alcohol use, just people being curious or using because of easy access. It's something that somebody in their life uses, so they're just genuinely curious what it feels like, what it's about. So we see a lot of that, but those are the most common I see with adolescents.
Would you say, like you said, is it because it's easier to access? Is that just like things that are trending right now, so kids are more likely using it because it's trending? What do you think is causing it?
I think it's a couple of things. Definitely easy access. When you look at surveys and the PAYS state data and different things like that, students will always say that they explored substances because a friend was using it out of curiosity or easy access. So it was laying around, it was somewhere where they could take it and try it, and maybe no one would even notice it. I also think social media is a huge thing with that. So TikToks and Snapchats and all of that, where they're doing vaping challenges and smoke contests and all of these different things. In general, the tobacco industry, I think, targets adolescents with these really cool flavors, and it's much healthier than cigarettes, and it's not that bad for you. And unfortunately, that just isn't the truth. But I think that has a lot to do with it.
What would you say? I know it's tough to manage what kids are doing, especially in schools. As much as you set rules, sometimes it can be hard to, sometimes they go to the bathroom and, they'll smoke or something. What are your guys' things that you're doing to try to prevent that, or maybe do like education for the kids to really understand? Because I know it must be tough.
I know a lot of our behavior infractions definitely have to do with vaping. And I can't speak for all schools, but I know like in our school, there are detectors in the bathroom that can pick up the scent. All like children go through the metal detectors, but they do find ways to get those little vapes through. So again, but just a lot of like prevention work and trying to let them know, the dangers of that.
Yeah. I feel like it's so important having those like visuals, because I know for me, I've never tried smoking, but once you see like the visuals on the effects it has, it's like, oh my goodness, like I didn't really think of that until I see it up front. So yeah.
And I know from when we were in school and we did like the DARE program, that like scared me straight. So early intervention education is really definitely very important.
Yes, that's a huge part of Pyramid's SAP program. So we go into the majority of schools in Erie County and we do a lot of education. So the classroom curriculums and prevention. And it's not necessarily DARE anymore, but it's kind of our version. I think the biggest thing is just kind of like debunking those myths out there. Vaping has been around for a while, so there's a lot of long-term data coming out showing it's really not healthy. It's really not as great as, cigarettes, but it's still really dangerous for your lungs. They talk a lot about the E. coli, which is like a vaping-related illness and a lung injury, which right now is untreatable. So there's a lot coming out, and I think if you're not giving them that education, instead of just don't do it, we need to tell them, why is it bad for you? Why shouldn't you use it? What other things could you be doing? And the school system and teachers and things that Pati do are a huge piece of that.
I feel like for teens especially, remembering how I was as a teenager, if I'm told not to do something, I'm going to want to do it. But so the why is really important. So like, why is this not safe? And I feel like that goes for everything, not even just drug use. Explaining why there's certain rules in place is just important for teens. They're going to do it if you tell them not to. So
for sure. Being a teen is hard. If you think back to your middle school and your high school experiences, I wouldn't want to go back. That's for sure. And I think now they have it a little bit harder. There's a lot more technology. We definitely didn't have those type of things around when I was younger, but there's still, the peer pressure, the parties, the different things that you're introduced to. So just giving them the information and the support to be able to make a smart choice.
That kind of segues into our next question. What factors are contributing to the increase in mental health struggles and substance use among teens today?
I know the pandemic is over, but I still think that we see a lot of those post-pandemic issues from all the seclusion and everything that everyone went through. I think that that's still affecting, everyone. I also think like social media, like you were mentioning it, and digital, that has a huge influence on kids as well as, family history. Some kids are very genetically loaded to develop a mental health illness. And so even just as well as like individual trauma and various issues along those lines, they really can set some kids up for difficulty.
Yeah, absolutely. I feel like especially social media nowadays, they're getting younger and younger, the access to social media and seeing what their peers are up to, and kind of like the fear of missing out.
Yeah.
And I'm sure plays
FOMO.
a huge role. Yes, exactly.
We had this conversation with another guest too. We're sort of lacking those third spaces. So we have home, work, or school, and then like a free place for people to gather. Like for some people it's church, but some people don't go to church. So there's not that like free space where people can just hang out with one another. So I think kids are using social media as that, but you may feel connected online, but you don't actually know who you're connected to. So the social aspect may be there, but you're not getting the human connection.
I think it makes it harder too to have an actual conversation with a real life person. You're
Yeah.
so used
Right.
to like sending a message and reaching out to someone, and I think that's part of it too. It's that I think some people are afraid to actually tell someone, a real person sitting there in the
Right.
school, what's going on, or I feel really depressed, or I'm having these feelings, especially if they went through COVID, and like middle schoolers now and high schoolers, you missed some of that social development, and I think it makes it harder.
Definitely.
Yeah, absolutely.
Definitely.
Yeah, the majority of their friends could be people online from a different state that they have no like physical interaction with, and these are the people that they feel like the closest to, which can be dangerous because half the time we don't know exactly where that person comes from and their
Yeah.
background.
Absolutely.
It's very scary.
It is terrifying. What are your guys' thoughts on how we can prevent that, and kind of shield these kids from the dangers of social media? Do you guys have any thoughts on that?
I mean, I think simply having conversations, I know that seems silly, but like, let's talk about it. So, you have conversations. I encourage parents to, communicate with their kids, like why is it, that we need to have some boundaries in place, or some safekeepings, or check their phones, or you can have this app but not this one, or hey, I want to be a little bit more involved. I think it's just monitoring. I see and work with a lot of folks that don't have structure and sometimes don't have that in their lives, and I think they're a little bit more inclined for some of those riskier behaviors because there's nobody kind of looking out for them, if that makes sense.
Yeah. Absolutely.
The whole debate of the cell phones, that's always a big thing in public education. But, we are seeing these kids get cell phones younger and younger and younger to even like first grade. And so with no real boundaries on them. So, like Leanne was saying, like really educating kids, really paying attention to what's on their phone because it's just going to get worse, as they get older. So monitoring that.
Yeah. My first cell phone, I think, was in like 8th grade, and it was a flip phone, so I did not have internet
Yes.
access.
Yeah. Different times.
Yeah.
Yeah, I
Definitely.
think same here.
Kind of getting more into the schools. We mentioned it briefly. Can you explain what SAP is? It's the Student Assistance Program, and how it helps identify and support students who may be struggling?
Yeah, I can share a little bit what SAP is, and then I'll kind of hand it off to Patty. But SAP is embedded in every school, and it is a team of professionals. So that team could be administrators, nurses, school psychologist, special ed, the nurse, maybe school resource offices, and really it's just a lot of other agencies like myself and Patty that come in, and we each have our own specialty, right? So as a team collectively, the goal is to help remove barriers that prevent a student from being successful in school, whatever that may be. It could be a referral, it could be getting insurance so that you can access the right care, it could be basic necessities, so like DNA need a meal? Do you need clothing? Do you need various things? Sometimes there are behavioral issues, and we kind of need to look at that. But for Pyramid, we are the drug and alcohol liaisons in the schools. So that's kind of our specialty where we stick to that. But there's many different parts of it.
Yeah, so the Student Assistance Program, it's been around for over 30 years, and it's also mandated. It's a mandated program in Pennsylvania, so all schools need to follow that. But it's a collaboration between Health and Human Services and the Department of Ed. And so, like Leanne was saying, there's various people that sit on that team, and in order to sit on that team, you have to be like fully trained. So typically there's a 3 or 4 day training. I know it's been reduced recently, but so you have to go through that training. And it basically becomes kind of like a triage, like you would see in a hospital. You know, you get a referral from someone, and a referral can come from anyone, whether that's a teacher, a parent, someone from outside, and it lists the concern that they have for that student. And then the goal of the team then is to start collecting some information and to identify, you know, what issues. But right from the beginning, we really want to partner with the parent, you know, letting them know, you know, that their child has been referred. But a lot of times it is the parent who makes the referral, so there's that partnership right at the beginning. And then as part of that process, if you're going to go any further, that parent permission piece needs to be in place, especially for the DNA and the mental health. We cannot just go in and do an evaluation without formal permission. And so again, there's that information gathering, then the team comes up with an action plan, who might be the best person to work with that student, and it might be multiple people. So again, we have teachers, we have special ed, we have case managers, and then the mental health piece, you know, as well. So in my role, I would deal and work with those students who are presenting more with emotional concerns. But it is a process, and then if necessary, I would make a recommendation to outside services if I felt it was beyond the scope of the school. And many times I will make that referral. However, I continue to monitor them in school. So it's a refer out if necessary, but there's a constant follow-up and support. And if there is a referral, then I would, you know, continue to maintain contact with that referral source as well. So the numbers are very, very high across all districts. But Erie's, because it's such a large district, we do have a lot of referrals to our SAP program.
That's amazing work that you guys do. I mean, I truthfully didn't know about it before today. So thank you so much. That is absolutely incredible. If a student thinks that they could benefit from SAP, is a student able to reach out and say, hey, I want this help? Or is it more of, like you said, the parents and other individuals
Absolutely.
reaching out?
And especially at the high school level, you know, kids are a little bit more mature. They absolutely will refer themselves and wanting to get that support. And again, the child also has to be on board with it too. It's a voluntary thing. So, you know, most of the time, you know, they are on board, but it has to be both the child and the parent that are saying yes to that.
If you ever get any resistance from a child, let's say they're like, I don't want to do this, or maybe even a parent, how do you go about that? Because, you know, you want to help this individual and you see the need for it, but if they're resistant, since you both need both parties to agree, you know, how do you guys go about that process?
I start with just a conversation, introducing myself, just sharing about all the various services. Sometimes there is stigma, right? So like, oh, I don't want to meet with Pyramid because it's addiction treatment, but we can do so much more, right? At the SAP level, let me just give you some education. Let's meet for a couple sessions and then let's go from there and decide. Sometimes the word treatment can be very scary. And so sometimes if you're explaining, well, right now SAP isn't treatment, it's prevention, right? It's education, it's support. So we're going to start there. And then we're going to work our way up. And sometimes, I mean, I like to say it's all about establishing the rapport too. So sometimes a student may be really, really quiet and they may be, you know, a little bit more closed-minded and they may not be sure. But after a whole conversation, they'll be like, you know what? I'll meet with you again next week. And I think that's a success, right? And it's like, okay, great. Like, I'll see you next Tuesday, and then we'll go from there. And then each session, you kind of dive in a little bit more. The great thing with the SAP program is they can stay open the whole entire school year. And if they really benefit from them, they can even sign up for next school year. So it's a long-term, support if they choose. And sometimes it takes a little bit to establish the rapport. So.
Yeah, sometimes they may initially say no. So that doesn't mean like we just push them off to the side and never revisit it. Sometimes, we'll give it a little bit of time and touch base with them again and see how they're feeling about it. Or maybe just recommend something a little less, intensive within the school. Maybe we're just going to have a certain teacher keep an eye out for them. But we always want to make sure that we have eyes on kids that are presenting with some special issues.
Absolutely. Thank you guys for the work you do, truly.
Talking about kind of presenting symptoms or warning signs, what should parents, caregivers, educators be watching for as warning signs that a teen might be struggling with either the mental health or substance misuse?
I see a lot of physical and behavioral and even maybe some mental symptoms. I mean, it doesn't always mean that there's something going on, but if they're just not themselves anymore, right? If it's normally a talkative person and they're isolating a lot, or a parent says, yeah, for the past week they've done nothing but isolate in their room, they haven't come down for dinner, they're sleeping a lot. I also say a more physical one to watch for is just any sudden weight change or change in appearance in general. But it could also be where they're a little bit more behavioral changes. So maybe they usually, there's some outbursts, or they don't want to follow rules, or they're a little bit more, they don't want to come home at 9, or they're hanging out with this new group of friends that's older. They're not always signs that they're 100%. Doing something like using substances, but those are things that we definitely look for.
Yeah, I always like to look at it as intensity and duration, because especially in teens could we know they're moody, we know they're dramatic, we know they like to sleep a lot. So, but again, it's kind of like a change from their normal pattern. Weight loss, weight gain. In school, there's a change in academic performance. Maybe their grades are dropping, or they don't seem to really care about their grades anymore. That's social isolation. Their mood is low, or they're also like worrying about things to an excessive level. So again, I think that anybody on any given day can look like maybe they're depressed or anxious, but it's that continual pattern of it that then becomes something we need to look into.
Yeah.
So what does the process look like when, you get this referral, whether it be a self-referral or someone else sends it? What does the process look like for the students? What are the steps, if you don't mind taking us through those?
Sure. So once we receive the referral, it gets assigned to a case manager. And a case manager on the team is a teacher, a counselor, someone within that school's team. And then that person's job is to reach out to the parents to obtain that parent permission, as well as a meeting with the child. And then we send out checklists to, again, all with permission. We send out checklists to the teachers that have that student, so we can get some more knowledge about what's going on. And between the information from the teachers, other people who are involved in the student's life, then we decide, okay, what do we think is going on? And then we formulate an action plan. And again, if the issue seems to be more, mental health, then that student would come my way. If it would be more drug and alcohol, then we make that referral out. And sometimes it just might be, a school counselor monitoring, or someone on the team kind of monitoring and keeping eyes. There's academic interventions that we can recommend as well. So again, it's, collecting that information so we know where to go with it, and then, making those appropriate connections.
Awesome. So from now going into treatment and recovery, from a treatment standpoint, what does support for a teen dealing with both substance misuse and mental health concerns typically look like?
Well, I would say it's really important to concurrently treat both. So it does involve the agencies or those involved coordinating care. Certainly we're going to take care of the DNA side of things, and we'll help check in on things like risk and safety needs, medication compliance, any symptoms. But really it takes a team, right? And if someone is reporting they're using substances because they're depressed, well, then we're never going to be able to really get into the drug and alcohol treatment and recovery without that piece as well.
Right.
So it's a team effort. It's kind of like the chicken or egg, what came first. Sometimes you don't really know. And unfortunately, there's a lot of folks who got into substance use or addictions because they were self-medicating, for anxiety, depression, other things like that. So it's really important to kind of have both sides. I do know that when a referral is made and we decide that, okay, we need some mental health or we need some drug and alcohol, we usually start, and I would say Patty has the same process, but there's usually a screening, like what are the symptoms? Do you take meds? What's your history look like? Are you open with any treatment providers? And then there's a more lengthier formal assessment. From there, we kind of give our recommendations and we kind of say, hey, I think that you would be a great, candidate for treatment. And then we just see if they're on board, right? We kind of start there by making some recommendations, seeing what they're willing to do. Sometimes they're not willing to go with our recommendations, and that's okay because we're not going to leave them with nothing, right? We're going to come up with some sort of plan, but that's traditionally what it looks like. The nice thing about DNA treatment is that for us at Pyramid, we can provide outpatient treatment at some of the schools. So it's really great because, if you think about Union City and Northeast, sometimes they're 45 minutes from our office. So it's really great to be able to remove some of that transportation barriers, and we can see them at school to help them be a little bit more successful, receive the treatment they need.
Yeah, so like Leanne was saying, there's a process to kind of determine that level of care. With our high school students, with the mental health piece, we do a computerized screening initially, and that just kind of looks for some red flags. And then we do a full-blown assessment to determine what level of care would be the most appropriate. So with our recommendations, there's a lot of different recommendations that you can make. Now, some of our schools, not all of them, do have, they're called satellite offices for some providers. And so, like, say, for example, Family Services is in one of our schools. So they can see, we can refer directly to them within the school. And that does make, a lot of sense, but we don't have it in all of our schools. And it's hard because there's a little bit of a provider shortage to be able to cover all the schools. But when we look at, like, levels of care, there's outpatient, and that's typically going to see a therapist maybe one time a week, one time every other week. There's family counseling. There can be MST, which stands for multisystemic therapy, which is more like a family-based type of treatment, along with something that's called family-based mental health treatment. And that's pretty, as I'm going through, it's getting more and more intensive. There's a level that's called an acute partial program, and that's a day program that they actually go to a treatment center, and then they come home at night. And then as we go up, there's inpatient and then residential. Obviously, we want to avoid that, but there's different levels of care depending on that student's needs. And their history too. Yeah.
How does Pyramid approach treatment for teens or adolescents, and what makes it different than treatment for adults?
There isn't much of a difference, right? So for the adolescents, we definitely we encourage it for everyone, whether you're an adult or an adolescent, but family sessions. We really invite the parents, the guardians, the grandparents, whoever is that main support in the adolescent's life. We like to do a lot of sessions involving them, just because unfortunately, sometimes if it's a communication issue, if it's we need to set some rules and some boundaries, a lot of times, those guardians don't know what the adolescents are doing. And while we have to respect confidentiality in some forms, we also need to they go home at the end of the day, right? And so if things aren't always changing in the home, sometimes that isn't setting them up for success when they come to us, right? It's something that's commonly when they go to inpatient or residential units. It's great that they're making all this progress and success, but sometimes when you come home, if things are still the same, that kind of can be a barrier, right, to that long-term success. So we definitely encourage that. Like I said, at Pyramid, we do have some higher levels of care, but for outpatient, we do have some based within certain schools. So that's really helpful. We use evidence-based curriculums and practices, such as if you've ever heard of cognitive behavioral therapy, motivational interviewing, so all of those fun things. And I think just transportation and access to care is really hard. So we try to remove those barriers. At our Erie office, we do provide transportation. So we can pick up the students at school, at home, and then bring them to our services. So sometimes that helps too, because, if we're asking them to come to group at 4 and parents still work and they live 30 minutes away, that can be a barrier to accessing treatment. So we are fortunate that our office is able to help with that.
That's great.
I feel like a broken record. Almost every episode, we talk about how important support is. Have you guys had experiences where you've seen, if an individual's family isn't as interactive or supportive or part of that process compared to someone's family who is, more hands-on and really trying to do more? Have you seen a difference between the two for the individuals?
Unfortunately, yes. So we have a lot of lack of parent engagement, or they're supportive and they're gonna give us permission to see their child, but they may not be as involved, right, in those family sessions. Unfortunately, as much as I'd love to say every kid has a family member or support engaging in those type of things, there's actually a lot that don't. And that's kind of where, and I know Pati would agree, okay, so what other community supports can we get you? Do you need a caseworker? Do you need a peer support person? Can we get you interested in some clubs and sports or different things available through the school, really helping them find supports? But I think at the end of the day, it comes back to why we do what we do, because of we're their supports, right? So I'm really sorry, your parents aren't here today, but let's together see what we can do better and how can we figure this out together, and just an overall team support. I know that when we have adolescents, it's just extremely important just reaching out to having them on the SAP team, having teachers, different people to be able to check in on them, right? Because I'll see you at 4 to 7, but if you're struggling through the day and you're in school, it's really helpful if someone from Patty's team can check in, and then we both can kind of coordinate. So unfortunately, and I think sometimes it's stigma too, or maybe adults and their families are struggling with issues themselves. They don't know how to help, or maybe they're embarrassed. It's why the SAP program is so great, right? Because it gives this kind of the school personnel and the team a chance to be able to help them.
Yeah, absolutely.
Do you want to do this one? A success story?
Yeah.
Okay. Along the same lines, are you able to share a success story of how early intervention and the SAP program maybe made a difference in a teenager's life? Obviously anonymously.
Yeah. I mean, I can for sure share some stories. I think, there's small ones and there's small successes, and then there's some really large ones. So it can really vary. But we have worked with some students who we perhaps met in middle school. Maybe they got caught with a vape. They were making some not great choices. We dived a little bit deeper after working with them, and we realized, okay, maybe you do have some anxiety and depression. Maybe it's just more than a feeling, or it's something a little bit more. And then we connected them with all of the great resources, and they maybe got on meds, or they just they started seeing someone for their trauma, or different things. It's like peeling an onion, right? So as you're working with them and we're working through all these things, and then a huge success is when they're like, you know what, I don't need to vape, or I'm going to actually use that coping skill you taught me about, and I'm taking my meds. And then you see their grades increasing, and then you see them joining a sports, or just even graduating. For some people, graduating is a huge success. And sometimes when you meet with them in middle school and high school, they're really unsure about what they even want in life, and that's okay, right? But if we can get them to maybe see, like, you know what, that was really stupid that I was doing that, or I wasn't, you're right, I was hanging out with the wrong people and they weren't great for me. It's even like, I don't want to say maturing, but it's like they're realizing that they don't want their life to be a certain way, and they're changing it, right? Because, you know, we all look back and we made some mistakes, we had some regrets, right? But we learned through them, and we became these really great people, and it's really rewarding from the school's perspective, because you can really start to see them change into this person. Not that you don't see that with adults, but it's a little bit of a different feel, I notice.
Right. I mean, the successes can be, you know, like Leanne said, like a big success or even a small success. So, you know, even it's, you know, just some of their relationships are improving, or, you know, they're graduating. I've been with the district a long time, and so it's wonderful to see sometimes, you know, I get like, you know, an email or someone reaches out to me about what they're doing right now in their life. And I just had like a previous kiddo that I worked with that's just getting her own doctorate or going into nursing. One's a psychiatric nurse, and it's like, you just don't even understand like the impact that you're having. I've had the opportunity, just actually over the summer, I ran into, while I was walking with a previous student, and, you know, she was wonderful. She's like, you know, you saved my life. And I was like I wouldn't have even thought of it that way, because I was just, you know, I was being myself and I was being supportive. But it's so important to them to feel like they have someone, you know, that's looking out for them and on their side. So it's those things that are like make the job worth it. And you don't get it all the time. And sometimes, you know, it takes a while to get it, but it's those little like kids getting back in touch with you and telling you, you know, what they're doing, and, you know, you're so proud of them.
I love that.
That is
Yeah,
amazing. It makes everything worth it. I feel like when you get those success stories, that's amazing. So what are some of the biggest challenges that you guys face when it comes to reducing stigma? As we know, there's still so much stigma going around mental health, substance misuse, and the different areas for both young people that you work with.
I think the biggest challenge that I run into is just that common, like, that doesn't happen at this school, or that doesn't happen in this family. Or, you know, I look at my daughter's phone. We don't allow that. And the truth is that addiction is everywhere. If you think about it, everyone in their life has known someone who uses it, or they think they use it too much, or they once were offered it, right? We all have those same stories. So it's naive to think that it doesn't happen here, or it doesn't happen at our school. That's the biggest barrier. I think it's, you know, we just want to come in and give some education and be real and have conversations. But I think sometimes the word addiction or treatment or things like that scares people away from the get-go. But I mean, just simply giving them the education, right, is the biggest step. So I see a lot of that.
Yeah. I think too, especially with mental health, there's a lot of misconceptions about mental health, and, you know, the media and movies, they don't do anything to help that. You know, they always talk about like the murderer has, you know, mental health issues, or, I mean, they always are depicting it in such a negative manner. So, you know, really educating and, you know, understanding there's such varying levels of mental illness, and also being very culturally sensitive, because, you know, not all cultures, you know, believe in therapy, whether it's for drug and alcohol or mental health. So trying to find different ways to reduce those barriers with those families. I do think that the stigma around it has gotten better, because I think we were seeing more kids reaching out for help, which is a good sign, you know. But it's still preventing, you know, I think even to older generations of maybe allowing that for their kids, or, you know, wanting to have it for themselves too. So
Yeah, definitely.
I do agree. I feel like it has gotten better. What Abby and I always say is we hope, as sad as it would be because we love our podcast, we truly do hope that one day the podcast isn't needed to, you know, try to defeat stigma. It would be sad because we love meeting everyone, but that is our goal, is to hopefully one day just be like, hey, we can openly talk about it, and there's no stigma surrounding it.
How can schools, parents, the community better work together to support teens before mental health or substance misuse escalates to a severe problem?
I think just simply welcoming conversations and continuing to educate yourself. You don't have to work at a school or an agency, right? Or have a podcast to kind of like broaden your mind and say, you know, why is vaping really bad? You know, just continuing to kind of educate and open those conversations. A lot of people, unfortunately, are not open. Right? Or maybe they're going to listen to the podcast because they don't want to have a conversation, right? I think just preparing them for the future, especially younger generations. So, you know, if you and I were going to our first party and someone offered us a drink, as a parent, I'd want to be like, well, what are you going to say? Let's rehearse it, because sometimes we see a lot, they're like, I know I should have said no, but the peer pressure, maybe you weren't assertive, maybe you were trying to make friends, or, you know, there's just a lot into it. So sometimes it's not as simple as don't do drugs. Right? Like, it's a little bit more in depth, especially if you're not an assertive person, or maybe you have confidence issues, right? Like, there's a lot of high expectations I think the younger generation has to look and behave and do things a certain way. So there's a lot of pressure.
Yeah, and just, you know, schools and parents, like, and agencies, just all being on the same page. And we do. We all really want to see these kids be successful. And so, and I understand that sometimes parents might have a negative opinion of schools. Maybe all they've ever gotten was just, you know, calls that their child is failing or this, that, and the other. So really, you know, trying to make, you know, the whole experience, you know, positive, and just partnering with them from the very beginning, and really starting where they're at too, you know, because you can't force a parent to do something that they might not be ready for.
Yeah, definitely.
Absolutely. So for teens listening right now who might be struggling, or for parents who might be concerned, what is a message that you have for them today?
I think it's simple. Let's talk. Let's have a conversation, right? I know I feel like that broken record there, but I think I would love for people to know you're not alone, and it's okay if you're not ready to make a change right now. It's okay if you're even unsure you want to stop, you know, it's okay. But I think if you give places like Pati and I a chance to just sit down, let's talk. Like, what are you struggling with? What's the main issue? And then kind of be able to even have the chance and the opportunity to give them some information. Even if I can't help someone, I'm not going to let them go without an answer or a support or a referral or, hey, give Pati a call. I think it's just, let's talk. And sometimes that's really hard, right? You have to have a lot of courage to reach out and say, you know what, I think I have a problem, or I think I'm really depressed, or I think this is more than just like a thing I'm going through, right? It takes a lot of courage. So it's okay if you don't know how to change, or if you're not ready to tell your parents, or you don't know where to start. It's okay. Let's talk.
Yeah, I would definitely agree with that they're not alone, and that there are, you know, caring individuals out there who, you know, want to listen to them and validate them. Many teenagers, you know, when we're having conversations, you know, they think that what they're experiencing is something that's such isolation, or like their anxiety, they're embarrassed about it. And when we really get to talking, it's like, you know, that it's not unusual. You're not, you know, some anomaly. This happens to a lot of kids. So just knowing, just to give it a try. And sometimes it does take some time to find the right therapist or the right match. But that, you know, if you can find that right match, it can be life-changing.
Yeah,
Absolutely.
super important to just keep trying different things. There's like so many different resources, and even at one resource there's like 8 therapists. There's just so many there's so many people and places to reach out to. So education, I think,
and especially at the school level, there's so many, you know, sometimes like maybe even the best influence on a child's life is maybe one of their teachers, someone that they have a great relationship with, can do more for a child than, you know, someone who is an expert, you know, in human behavior. So again, it's a lot about the relationships that they have.
Yeah, and at schools, you spend the first 18 years of your life at a school every day for 8 hours. So, like, having those services there makes so much sense. They spend so much of their time there. It feels like for some kids, they are fully themselves there, or some are at home. So having the options is important too, whether it's like outside of school or in school. There's lots for everyone. Our final question for you both today: How can anyone watching learn more about SAP, Pyramid, and other resources available locally?
So Pyramid has quite a few ones, and I'll kind of start. So we do have a website. Of course, you can Google Pyramid Healthcare. We have a really great webpage that will share all of our offices, locations. We're in several different states, so we offer a variety of programs. Of course, it will tell you about all the services at the Erie Outpatient Office. We do have also a 24/7 admissions number, and so that number is 1-888-694 9996. So I know that's a lot to remember. There's also on our website, there is a chat function. So maybe you don't want to speak with someone on the phone and you just kind of want to start by reaching out. I always welcome conversations and people to stop into our office. We're at a lot of community events and different things like that. We are located at 26 and Brown Ave, and our office phone number is 814-456-2203. So lots of numbers there. There's lots of ways. And I know Patty's going to share a little bit, but if you are ever interested in your child receiving even education or anything like that related to drugs and alcohol, all they have to do is reach out to their school. Sometimes it's on the websites, but you can just sign up for the SAP program through there.
Yeah. So from a school perspective, I mean, every school has their own website as well as like the general website for the district. And it's not just Erie, Mill Creek, all those school districts will have that listed, especially if you look under student services or student supports. For a parent, if they do have a concern, it's very easy to just contact the school directly. School counselors are a great place to start. And just requesting some information. There's some wonderful websites. I mean, PNOS is a great one. It's PNSAS. It's Pennsylvania Network for Student Assistance Services. They provide a lot of information as to what, SAP is in schools and information for teams and members. So there's a lot of really, really great information. And I think that just reaching out to your school is a first step in trying to get help for your child.
Yeah.
Yeah. Well, thank you both so much for joining us, because it is really important to talk about, the younger generations and early intervention and, the resources that are out there. So we truly appreciate both of you taking the time to join us today and share that with our listeners.
Thank you.
Yeah.
Thank you for having us. It was fun.
Yeah. And thank you guys for watching and for tuning in. And we'll see you next time. Bye.
Thanks for joining us on this episode of Stigma Stompers Podcast. We truly appreciate all your support.
If you want to see more about what we do in our community, make sure you check out our website. It's namierie.org. Make sure you also click on our t-shirt store tab so you can buy a t-shirt. We get a portion of all the proceeds. And make sure you sign up for our newsletter. It has all of our programming and event updates.
Another way you can get involved is if you feel comfortable sharing your personal story. You can email us at info@namierie.org, or you can give us a call at 814-456-1773.
Thank you for tuning in, and we'll see you next time. Bye!